Hi, everybody. For my final summary project presentation, I'm going to be talking about sexuality, youth, and social work. So, defining sexuality, youth, and social work, as described by Bywater and Jones, the concept of young people is relative based on various social factors that, for the purposes of this presentation, we'll be using the age range of 11 to 18. So, youth as a social construct is something that's important to consider because the idea of youth changes based on cultural, religious, or social factors. During youth, there's various psychosocial changes that are going on, and Dogra, I'll talk about them. Some of these are sexuality, sexual orientation, gender identification, gender role adoption, sexual identity, as well as personal identity, values and independence as they move into adulthood. And it's important to understand the diversity that exists among youth, as we would consider with any other population, and not just understanding youth as a sort of singular type group, but understanding the various forms of diversity that exists and the implication of oppression. From the macro level, practice level, gender is an important consideration as youth develop their sexual identity. There are various implications for females versus males. Females, in particular, the idea of femininity and not being over sexualized. Males, adoption of hypersexuality and the power imbalances that exist in terms of gender relationships. Ethnicity and different understandings of youth and sexual practices are an important consideration. Culture and religion also play a role based on what is appropriate at different ages. Sexual education plays another important role in understanding youth sexual identity, because sexual education often is not inclusive of all of the different types of sexuality that exists among young people. For example, the lack of education surrounding intimacy, as well as lack of addressing that youth will be engaging in sexual relationships as part of their development, and the lack of diversity in terms of understanding sexuality for youth with different sexual orientations. This plays into the idea of heteronormativity, where ideas of what youth sexuality looks like is centered around heteronormative ideologies, and the idea of sexual risk and managing sexual risk and promoting healthy practices and reducing risk factors for things like sexually transmitted infections or pregnancy. In terms of PARS, we need to be aware of our individual values and experiences regarding sexuality and the sexuality of young people. We also need to be aware of the social construction of the sexuality of young people, the social stigma and stereotypes that exist for youth who are engaging in sexual activities. And we also need to be aware of societal and personal ideologies surrounding the sexuality of youth. When looking at circles of sexuality, it's important to understand the idea of sexualization. Again, this idea of the gender playing a role in sexuality, and the sexualization of women and their bodies, and how they are often the gatekeepers in terms of contraception, and young males are encouraged to exert hypermasculine, overly sexualized perceptions within society. Sensuality and intimacy need to be included in terms of social discourse. There's a lack of this in terms of the education and knowledge that's being taught to young people. Reproduction and sexual health. We need to be able to provide young people with accurate sexual health information in order to promote safe and informed choices. Sexual identity needs to be included in terms of a diverse understanding of sexual identity, sexual orientation, and sexual fluidity. By providing trauma-informed care, we need to understand the impact and prevalence of trauma in children and youth and promote trauma-informed values of choice, empowerment, trust, collaboration, and safety. We also need to understand the risk of oppression and trauma histories, then be aware of societal factors contributing to trauma and how this can have an impact on youth sexuality. An example of this would be teenage pregnancy or sexual violence, where people with trauma histories or as a result of certain social factors like poverty, they might be at a higher risk for these things to happen. From a social justice perspective, the role of a social worker is to engage in advocacy for improved sex education for young people with accurate representations of the diversity of sexuality for young people. We need to educate young people with accurate information and acknowledge that sexuality is part of the healthy development of young people. We also need to advocate for social justice in terms of addressing discrimination and marginalization of young people, and the promotion of equal and diverse understandings of all types of sexuality and sexual orientation when we are considering youth and sexuality.